dry cough, fever, they may lose their smell and taste, and most importantly, they become breathless, short of breath. And that's when will have dry cough, fever, they may lose their smell and it's a new disease coming from wherever. So the patients will have dry cough, fever, they may lose their smell and taste, and most importantly, they become breathless, short of breath. And that's when it strikes that the disease is very severe. What is happening in the body is when the coronavirus infects us, there is an intense reaction of the body. Our immunology reacts in such a hard way that at times our own cells become damaging to ourselves. And by the way, we are learning as we go through. This is all my understanding. I'm going to just give you a brief introduction and then go to plasma therapy. We can divide coronavirus infection into 4 groups. The first group is asymptomatic, which means they do not have any symptoms, no test is done, and by God's grace, they recover. The second group is a mild symptoms, like they have fever, a little bit of cough, a little bit of breathlessness. When they do the test, which comes 5 days later, it is positive, they stay home. Over a period of 2 to 3 weeks, they recover. The third group is of moderate severity, and this is the group which probably ends up in the hospital. Some of them who are young are sent home. Others who have other comorbid conditions like hypertension, heart disease, diabetes, old age, they get admitted to the hospital. But they just require symptomatic treatment and supportive treatment, and they don't have to go to the ICU. 10 to 20% of these patients become very severe, and that is the fourth group which we are going to discuss today. They need admission to the ICU, and these are the most severe patients, and 50% of them going into the ICU die. So what are the possible treatments? The first treatment, they say, is hydroxychloroquine. And then you start an antibiotic called Z-Pak, which is Zithromax or azithromycin. The third treatment, which is proven, is an antiviral drug, which is only investigative, not available for everybody, and that's called remdesivir. The fourth treatment is this cytokine storm, which occurs because of the immunological reaction of the body. It is so intense, it is very damaging to our own organs. To suppress that, we have to give high-dose steroids and start on a drug called tocilizumab. The fifth treatment in ICU is, we think that there is microvascular abnormalities going on in the blood circulation and the blood is clotting. So we have to give them anticoagulation. After this, you need to support their breathing. Initially, you can do without ventilators, but eventually they will end up in ventilation. This is the time when they need much more advanced treatments, and one of them, which we are going to discuss in more detail, is the convulsant plasma transfusion. The way it works is, these patients who have recovered from coronavirus infection, you draw their blood because they now have antibodies and store it. You put this plasma back into the patients who are sick, and the antibodies reduce the intense reaction of the virus and make them feel better. And finally, the other treatment is ECMO, which is the most advanced of all the treatments which my friend is undergoing. So these are the 7 or 8 treatments which are necessary. And at every stage, we had difficulty getting these treatments to our dear friend. And that is because the universities, the treating hospitals have their own protocols, and they do not want to change their protocols. Case in point is, we had donors ready. with the plasma, and we could not give this plasma to our friend for 96 hours. Can you hear me? Hello?
Yeah, Yashwant, yes, we can.
Okay, so it took 96 hours before we could give plasma, and the constraints are it is a treatment which is not accepted. It is a treatment which is in development, and it is an experimental treatment. The institutions do not have any protocols yet. The blood collecting organizations like American Red Cross, like Varsity, which we worked, and other community local blood banks do not know how to collect, what to do, where to get this from. And then added to this difficulty, we had the barcode which is needed from FDA.